I'm Tom Stokel, and my wife Nancy and I formed Medical Ministries International back in 1998. We formed it because we had taken trips overseas and had seen the great need that is there overseas. And having worked in the medical field here in the United States, we knew the great excess that we have here. So MMI was formed to become a conduit between the great excess we have here in the States, to pass it through us, let us see what it is and make sure it's the right thing, and then send it overseas to places that desperately need medical equipment and supplies. So we've been doing this now for about 20 years, and during that time, we have taken 6 trips to the Democratic Republic of the Congo. A person here in Fresno asked us if we would go on the first trip. In fact, he talked to us a lot about, can you please come to my country and just look? And so we did. And we looked and we saw what they don't have in the Congo. We went to both hospitals in large cities and out in the field, out in the bush, and we saw that their shelves were empty. These were perfectly talented physicians and nurses who were working with whatever they had to work with. And if they didn't have what we would say is, oh, this is the only supply we can have, they worked with what they had. And they reused things that we would never reuse because that's all they had. So that just increased our burden for the Congo and for the Congolese people, because if we could just give them the equipment and the supplies that they need to work better in that environment, then more people would be able to live. It would totally change the level of health in some areas. So that's what we've been doing. In the 6 trips there, we have worked out in the bush, in Kafumba and Malela, out of Kikwik. We have worked in Kinshasa. And now we are looking at this project that is taking place in Kinshasa. And the purpose of this project is to provide a health environment, a medical clinic and a medical hospital that is available for people who just can't afford to pay for it. And so this is a project that was wound up. It's from the very basic up. It's a building that is being built just to house this equipment and these supplies, and to start a clinic that will be available to those who simply have to choose between eating and getting medical care. So our project in this shipment is to move a full 40-foot container filled with everything from anesthesia machines, hospital beds, down to basic supplies like gauze and bandages. And since it's a new place, we're also sending waiting room chairs and other furniture that you just have to have if you're going to run a hospital.
We get a phone call from the Congo, and we just found out that my mother-in-law was sick. And so we started sending all kinds of financial support to see if they can take her to any of the hospitals to find out what was wrong with her so that she can get the treatment she needed. But unfortunately, they couldn't find anything. Finally, they took her to a hospital, one of the only hospitals that had ultrasound capability, and that's where they were able to see that she had some kind of mass in her stomach. And so they called us and let us know that they found something and they will have surgery and that they needed money to do that. And so we connected with the family and sent the money so that they can have surgery. And just to find out again, a couple months after, that she got worse. And so we couldn't understand what was going on. We thought that this was over. And so I called my brother, who was a doctor, and I sent him to go visit my mother-in-law. And when he went there to talk to the doctors and to talk to the people that were taking care of the patient, he called me back and said she's not going to have long to live because she's having a hard time breathing. That means her lungs has been affected. Her eyes are turning yellow. That means her livers are not working perfectly. And her feet are swollen. That means her kidney are not working right. And if they removed a tumor, there is chances that that tumor was cancerous, that she has cancer. And if she has cancer, that means it's all spread in her body and she doesn't have long to live. And this was so painful for me because I realized that God has blessed me with this beautiful vision to build a clinic to save life. My mother-in-law was a pastor. She worked with several churches helping women's ministry in different churches. She served God her whole life, and yet we were not there able to save her just because they didn't have an ultrasound machine to figure out that she had cancer early and to be able to address it properly. And so I was determined to do whatever it takes to actually start this clinic. We reached out to MMI, Medical Ministry International, a great organization here in Fresno that has been already in the Congo 6 times. And they were willing to send a container full of medical equipment that worth close to $400,000 to $500,000. And so I sat down with some of my friends. We said, we have to build a building so that we can use this medical equipment there, train people to save life. Do you know that out of 7 kids, 1 kid usually dies or most likely dies in the Congo? Do you know that in some of the villages, it's actually 1 out of 2 kids that never makes it to the age of 5? Many women dies of childbirth complication because of lack of prenatal care. Do you know that dialysis is a commodity in the Congo because to have dialysis done, you gotta pay $5,000 cash up front, and most people can't afford that. And so we thought whatever it's gonna take to build this building, we'll borrow money to make it happen. It turns out that to build a building like that, it only cost us $160,000. But do you know that in this country we build building day in and day out, building that we don't need, building that we want for additional program, and it costs us millions every year, when only $160,000 can build a clinic that will save generations. This is the reason why we do what we do. This is the reason why we started United for the Future. Not only to provide mentoring here in Fresno and save lives of many kids that don't have role models so that they don't end up in jail or they don't end up dead in the street, but that we may also be able to build this clinic in the Congo and to be able to save life. And this is where you come in. This is where you can help us. Help us build this building. Help us give out of whatever we have. I remember my parents giving out of their poverty. I know we can do better. This is what made me who I am, and this is the reason why I call for you guys to come alongside and support this vision so that we can be able to save life, because every life is worth saving. God bless you.